What is a cerebellar stroke? Imagine a part of your brain so small yet so vital that, when it's affected, your entire sense of balance and coordination can be thrown off. That's what happens in a cerebellar stroke. This type of stroke occurs when blood flow to the cerebellum, a tiny region at the back of your brain near the brainstem, gets interrupted. The interruption can happen because of a blockage, which is called an ischemic stroke, or because of bleeding, known as a hemorrhagic stroke. The cerebellum is responsible for helping you move smoothly, maintain your balance, control eye movements, and perform voluntary motor tasks. When its blood supply is cut off, brain cells in this area start to die, leading to various neurological problems. The cerebellum gets its blood from three main arteries: the superior cerebellar artery, the anterior inferior cerebellar artery, and the posterior inferior cerebellar artery. If any of these arteries are blocked or bleed, it can cause a cerebellar stroke. Symptoms often include vertigo, which is a spinning sensation, severe headache, vomiting, and dizziness. You might also experience ataxia, which is a loss of coordination, making walking or even holding objects difficult. Some people may have trouble with eye movements or speak with slurred speech. Because the cerebellum controls fine motor skills and balance, damage here often results in unsteady gait and difficulty maintaining posture. Although cerebellar strokes are less common than strokes affecting the larger parts of the brain, they still account for about 2 to 10% of all strokes. Their proximity to the brainstem makes them particularly serious, as swelling or bleeding can press on vital centers that control breathing and heart rate. If not treated quickly, complications like brainstem compression or fluid buildup in the brain, called hydrocephalus, can be life-threatening. Risk factors for a cerebellar stroke are similar to those for other types of strokes. These include high blood pressure, diabetes, high cholesterol, smoking, obesity, and heart conditions like atrial fibrillation. Substance abuse, especially with drugs like cocaine or amphetamines, can also increase risk. Age and family history play roles too, making some people more vulnerable than others. Doctors usually diagnose a cerebellar stroke through neurological exams and imaging tests, such as magnetic resonance imaging or computed tomography scans. These tests help confirm the location and type of stroke. Treatment depends on whether it's caused by a clot or bleeding. For ischemic strokes, clot-busting medications called thrombolytics may be used if given within a certain time window. Hemorrhagic strokes often requiring careful management to control bleeding and reduce pressure inside the skull. Recovery after a cerebellar stroke focuses on rehabilitation to improve balance, coordination, and motor skills. Physical therapy and occupational therapy are key to helping patients regain as much independence as possible and improve their quality of life. In summary, a cerebellar stroke is a serious event caused by interrupted blood flow to the cerebellum, leading to problems with movement and balance. Recognizing symptoms early and seeking prompt medical care can make a significant difference in outcomes. Always consult healthcare professionals for personalized advice and treatment options, as each case can vary widely.